If you come to a pain clinic and you come in and you indicate that you're in severe pain and the pain is constant and very disabling to you and interrupting the things you want to do in your life, all the reasons why you would come to a pain clinic, and you're on a significant dose of opioids, then it's kind of obvious at the end of the day that those opioids are not doing the job for you for controlling the pain that you would like controlled. And in that setting, we call that opioid unresponsive pain. And there is a component of different pain syndromes that are indeed that, opioid unresponsive. And typically we find that one of the underlying causes of this being unresponsive to opioids is the fact that the pain is of a nerve type pain, what we call neuropathic pain. So what are we going to do if you're on opioids and they're not working? In the old days, we would double, triple and quadruple the dose and see what happened. What we found out over a long period of time is that does not make it opioid responsive. It remains opioid unresponsive, and then side effects and complications occur, up to and including, unfortunately, obviously, fatal outcomes from suppression of breathing and so forth from those opioids. So what we practice these days is exploring what it's like for a patient to actually slowly reduce the opioid downwards. And what we find is in a majority of cases, probably say 80 to 90% of cases, we can successfully reduce the opioid with no worsening of pain at all, and often with a reduction in side effects, such as constipation, such as nausea, such as lack of appetite, such as tiredness, difficulty sleeping, and so forth. So reducing opioids allows the opportunity to trial other medications in combination with a reduced dose. And in fact, there'll be a subset of patients that'll be able to come off the opioid altogether with absolutely no change in their pain at all. So it turns out that the drug was actually useless for them. It can be a little bit tricky to understand this from the patient point of view, because often towards the end of the dose that you've taken in the morning, when you're ready to take the evening dose, you might notice that your pain gets a little bit worse, or you might be feeling a little bit irritable. Now that is not actually your original pain exposing itself to you. What it actually is the start of some withdrawal from the opioid, what we call an opioid withdrawal syndrome. And it can actually falsely increase your pain and give you the wrong impression that the drug is actually doing something. It's quite tricky from a pharmacological point of view. But the important thing is that you can come along and have a sensible and safe discussion with your pain specialist about whether the opioids are helping or whether they are not, and look at a staged and sensible reduction system that can minimize side effects as you reduce in order to explore what you're like on lower doses. So part of the many things we'll be doing is to look how to reduce your pain, how to optimize function, improve quality of life. And some of the time, if you're on opioids and they're not helping, then we'll look at opioid reduction as part of that process.